In this section, blood exposure procedure, the proctor will read, "You will demonstrate the blood exposure procedure. You will imagine the following scenario. During a service, your client has sustained a minor cut to the chin. The injury is such that you can continue with the service. You have not come into contact with blood and your work area has not been contaminated. You are expected to demonstrate the proper procedure for a blood exposure. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you have finished." The proctor will repeat the instructions and they will say, "You may begin." When they say you may begin, means you may sanitize. So sanitize your hands first. Then you're going to get your first aid kit and you're going to open it and take out on your SMA plastic bag. You need your gloves, you need an alcohol wipe, and a Band-Aid. Then what you want to do, close your first aid kit back up, set it out of the way, and then go ahead and get on your gloves. Okay, so get your gloves on. All right, so now take your bag and open it up. And then this is where you want to roll it and kind of twist it so the bag will stay open like this. Okay, and so you're going to have that pointing towards you. Then you're going to tear open your alcohol wipe and put the paper in the bag. Okay, then what you're going to do is just wipe an area on her chin, just a small area. You don't want to do too much because then the Band-Aid won't stick. Okay, so then you're going to open up your Band-Aid, take the paper, throw it in there. Now these two little plastic things, hold them on each finger, each hand. Let's see if I can grab this with these gloves being so big. Okay, hold them like this, and then you want to pull it like that. Okay, so there's the Band-Aid on her chin. These will go into the bag. Take your gloves, turn them inside out. Okay, and then they go in there, and then you want to turn your bag back this way, and you have to ziplock it closed. Okay, and it goes into the trash, and then you sanitize your hands, and then you step back, and then you wait for everybody to finish. One word of advice: every time you step back and you're waiting for others in the examination area, just remember this: the examiners are constantly watching you. So that means you can't pull your hair back. It can't mean you fix your clothing. You can't do any of that, because if you're doing that and you're not sanitizing your hands, then they will dock you points on that. So they are watching you the whole time, and they are checking your bags to make sure you're throwing things in the correct bags. Okay, and that is all we have.